Hi, Dr. Matt Wiederholtz again. This is the second part of the lower back series on causes of lower back pain and treatments for those causes. We talked about intervertebral disc disease. Next, I want to talk about lumbar facet disease. That sounds like a confusing term, however, it's really quite simple. The lumbar facet joints, other known as zygapophyseal joints or Z joints, are the joints in the back of the spine. As the bones come together, they form paired joints at each level of the spine. If we look at the larger model here, we can see paired joints up and down the spine at every level. In fact, they go all the way from the neck down into the lower back. Those joints allow for mobility in the spine. However, because they're joints, they're also susceptible to arthritis and joint disease. And facet joint disease happens to occur most commonly in our elderly population, the same people who get arthritis of the knees and hips and other joints as well. However, there is another patient population that tends to get facet disease, and that's patients who are involved in motor vehicle accidents. Car accident victims tend to have facet joint pain in the neck or the cervical region, and that's because of whiplash injuries. We call those acceleration-deceleration injuries, and that's when the neck is forcefully flexed and extended, and that causes a sprain of the ligaments that support these joints. And that can be very severe pain, and there are actually known referred pain patterns which tend to involve the muscles and the tissues in and around the facet joints. So unlike disc disease that tends to cause sciatica or nerve pain, searing pain down the leg or down the arm, facet joint pain tends to cause a dull, aching pain in and around the spine. There's usually an associated stiffness and muscle spasm with facet joint pain. Now let's talk a little bit about treatment for facet disease. Here at Performance Spine and Sports Medicine, again, we stress the integrative approach. So patients are not just getting one treatment modality. Facet joint pain can be diagnosed and treated with a facet joint injection. That's when a needle is placed directly into the facet joint to relieve inflammation and pain from facet-mediated pain. It's a very simple injection, takes only a few minutes to do, and can offer significant relief. For patients who get relief with these injections, but the pain keeps coming back, there's a procedure that we can offer you called radiofrequency neurotomy, where we place a small needle in the area of the facet joint where the nerve lives that innervates that joint and sends the pain signals up to the brain. And we can in fact block those pain signals for at least 6 to 12 months per treatment. In combination with those therapeutic modalities, we also incorporate physical therapy and chiropractic into your treatment regimen. That allows us to strengthen the muscles around the spine, giving you stability to the spine, preventing the increase in or the progression of facet joint pain. Chiropractic therapy can also offer DRX spinal decompression, and that can relieve pain not only of intervertebral disc origin, but also facet-mediated pain. One of the other treatment options available is nutritional interventions. My partners, Dr. Lopez and Dr. Jimenez, work tirelessly to not only develop supplements that can treat pain and inflammation, but also implement nutraceuticals that are already existing on the market